my research study was about measuring adherence to hydroxycarbamide for pediatric sickle cell patients. Hydroxycarbamide is the only licensed medication for sickle cell in pediatric patients in the UK. And there is no validated tool to measure and evaluate adherence at the moment. So we used a mixed methodology to try and measure this for our patients. We used an online survey, which was anonymous. We measured the prescription uptake, so medication possession ratios, and looked at how many days through the year they covered with prescriptions. And we also looked at some laboratory markers. And we looked at how these correlate between them and try to understand how they correlate with other clinical markers as well. So we found that they do correlate well between them. The reported adherence is quite high, up to 93% of patients said that they take the medication 80% of the time. However, looking at their medication possession ratios, this was lower. It was about 52%. And then looking at their laboratory values like the fetal hemoglobin and the neutrophil count, this was also quite down to 30%. So kind of some variation there along these lines. And then we also looked at how some of these laboratory values correlate with clinical parameters. And we found that the most significant ones are whether patients have been on it for a long time, whether they have been escalated to a maximum tolerated dose, and whether they have symptomatic sickle cell disease or not. So we feel these groups are the ones that we need to focus more in terms of improving adherence. So yeah, I think this is in summary the research. There's more research to be done on this subject, but we hope we're going to start and look at improving and evaluating adherence better in our sickle cell patients through this project.